Going through some of the other structures that you need to know on the skull, you do need to know the sutures of the skull. So, looking down from above, we have between the frontal and the parietal bones, the suture here is our coronal suture. You can remember that if we were doing a coronal plane through the skull, we will be going in that direction. Then between the two parietal bones, right here, we have our sagittal suture. Stop, Tony. And that would make sense as well if you're thinking about doing a sagittal section through the skull, right? We would make it along that line, sagittal suture. Then between the parietal and the temporal bone here, we have our squamous suture. Also on the back side of the skull here, you can see our lambdoid suture. Okay, so coronal, sagittal, squamous, lambdoid. Bone markings that you need to know associated with the temporal bone, so our temporal bone here, include the external auditory or external acoustic meatus here. This is the external opening of the temporal bone that leads to our inner ear. And then if we look inside the skull here, you can kind of think about where this might come out. We've got our internal acoustic meatus or internal auditory meatus located inside the skull. Styloid process is this kind of very pointed process, looks like a stylus or a pen. Then we have the mastoid process here. Muscles of the neck attach here. The mandibular fossa located here. And this is actually where the mandible is going to articulate. Zygomatic process. This actually forms part of your cheek. If we look in the inferior view, underneath, we've got our jugular foramen, where our jugular vein passes through, and then our carotid canal, which is the opening for the internal carotid artery. If we look inside the skull, you can't really see the carotid canal, but the jugular foramen can be viewed. Looking at markings and structures on the occipital bone. So, put this back together here. So, we're looking at our occipital bone actually extends inferiorly all the way down here. We've got the foramen magnum, and if you use your imagination, you can probably guess that the spinal cord and nerve fibers from the brain pass through here. And then on either side we have our occipital condyles, and these are what articulate with our atlas, or our first cervical vertebra.